Hey everybody, Luke Gordon here, and in this video I'm going to talk to you about how to use your inversion table to do intermittent traction, which is a really nice way to provide some pain relief for your lower back, so for lumbar pain, and also for things like sciatica, so your sciatic nerve pain, which is that pain running down the back of your leg. Now I've made some previous videos on how to use an inversion table, but it didn't occur to me until now that I didn't really talk about how to do intermittent traction. I talked mainly about how to just tip back and do a static traction. So in this video I'll give you a little bit of a background on why you might want to consider intermittent traction versus just a static or a sustained traction where you're tipping back and staying there, and then also how to figure out how long you should go back and what intermittent traction looks like in terms of coming back up and resting and some parameters there. But first, before you do either sustained traction or inversion or you do intermittent, what you want to do first is make sure that you've got your table set back to however far back that you want to go. Now on this table, which is a little bit older, you can see I've got a cord on the bottom there, and I can tighten that cord, or there's little loops with a carabiner, so I can change how far back the table goes based on the length of that cord. So that's how this one adjusts. In the newer tables, like the one I have at home, it's more like just a metal peg on the side where you can adjust the peg and it says like 45, 65, 85 degrees, stuff like that. So either way, you want to start, before you're doing either type of traction or inversion, you want to start just by making sure that's set correctly. And then so when it comes to, again, picking static versus intermittent, what you'll find is that sometimes, especially if you're newer with using an inversion table, is that you go back for 3 or 4 minutes and then it just starts to kind of hurt a little bit. So your back kind of locks up, maybe you're getting some muscle guard, maybe those joints, like your facet joints in your lower back, just aren't feeling great. Or if you're treating yourself for a disc bulge and that sciatic nerve pain, maybe it starts to come back a little bit. For whatever reason, you just feel like you get a little bit uncomfortable. So in that case, what I recommend is listen to your body, and at that point, you might start to think more about intermittent inversion. In which case, let's say you tip back and you go back for 3 or 4 minutes, and let's say you're back farther than that. There you go. So you're back all the way for 3 or 4 minutes. With intermittent traction, then what you're going to do is just come back up towards neutral after 3 or 4 minutes and come back up there for about 30 seconds or so. Now you can either go all the way back just to neutral, so there's no pressure on your spine, or you can go near neutral, so there's still a little bit of traction on your spine there. It's kind of up to you. What I would recommend, if you think that intermittent inversion, intermittent traction is really going to be helpful for you, is that you go back however far you feel comfortable and try to go back for 3 to 5 minutes, and then come up almost to neutral, so not quite to neutral. So if you can imagine, if you're still tipped back a little bit, you still have a little bit of decompression on your spine, you're decompressing your nerve roots, you're decompressing your discs, creating that nice negative pressure for a disc bulge to potentially reduce itself. And so you're still getting some of that benefit, but you're not completely loading your spine. So again, come back up to neutral for, let's say, about 30 seconds, or you could go 60 seconds if that feels better, and then go back again for another, let's say, 3 to 5 minutes. So what I would do, again, listen to your body on each time. Come back up slowly, of course, when you come all the way back up to neutral. Come and listen to your body and then see over time, can you build that up so that you're doing, let's say, 3 to 4 rounds of tipping back for 3 to 5 minutes. So let's say the total treatment time would be about 15 to 20 minutes then. So that's what I would recommend for intermittent traction. Again, if you look online, like in the literature, there are some types of diagnoses that tend to respond better to intermittent versus sustained. So again, you have to ask yourself questions on in terms of what are you trying to treat? Is it sore muscles? Is it joints? Is it nerve root impingement, bulging disc? But a lot of it really comes back to just listening to your body and seeing what feels best for you. So that's my advice on intermittent traction. Again, work up to that treatment session being about 15 to 20 minutes total. And if you have any other questions on inversion tables, I've got some more videos that I'll post at the end of this. If you got more questions on disc bulges, I have some of those videos as well, so I'll post those there. So that's my video on intermittent traction with an inversion table. Thank you for watching. Please like and subscribe before you go.